Good evening, everyone. I, Shubham Bharti, and Misbah Kadri will be the moderators for today's session. We welcome you all to Cynodent, Indian Society of Dentistry webinar series 2023. Theme for it's Unlocking Trend in Dentistry. For today's second session, we have with us Dr. Shalu Batla ma'am. She is the director of Zenith Academy Center for Perio Implant Lasers. Topic for the session is changing the face of periodontics with laser and implants. We would like ma'am to please start with the presentation. Ma'am, you can share your screen. Yes, ma'am.
It's visible. You can start with the presentation.
Yeah, very good evening. First of all, I'm really thankful to Cynodent, Dr. Shubham, Dr. Akshita, and Dr. Anmol and Dr. Misab. Really thank you for giving this virtual platform to share my little experience about lasers and implants. Although I know it's very difficult to sit at Saturday evening dinner time, but I will try to, be short with my presentation. So this is the actual scenario which comes with the actual scenario with the patients, which comes in a perio clinic. And yes, with the normal conventional scalpel, we can, eliminate and eradicate this condition and can produce such a beautiful, and healthy gums. But yes, with the lasers and with the implants, you can actually change the way we treat a perio patient. And in this presentation, I would tell you how we can, harness and use the lasers and implants to change the face of not only perio, but of dentistry as such. Well, coming up first, talking about the lasers. Laser light is different from the ordinary light. This is the typical three unique feature of laser, that it is monochromatic in nature as compared to the ordinary light. In the ordinary light is polychromatic in nature, whereas your laser light is monochromatic. It is unidirectional and it is coherent. That if the crust of the one wave will coincide with the crust of the other wave, and the trough of the one wave will coincide with the trough of the other wave. So it is coherent in nature. So these are the three basic difference between the laser light and your ordinary light. So this is a short video showing how the laser light is basically produced. I hope the voice is there. It's audible?
Yes, ma'am. Yes, ma'am. It's audible, ma'am. You can continue.
Sorry?
You are audible, ma'am. You can continue.
No, the video audio is there.
No, ma'am. The video audio is not there.
No, ma'am. No, ma'am.
Oh, okay. Never mind. Never mind. So, this is an optical cavity. In the optical cavity, on one side, there is one mirror, which is totally reflective, and there is another mirror, which is partially reflective in nature. Inside this optical cavity, there is an active medium. And according to this active medium, the laser light is defined as whether it is a solid, liquid, or the gaseous the laser is there. And the laser light is basically produced in this optical cavity, and then it is delivered with the help of three delivery system. One is your articulated arm, the other one is a hollow waveguide, the third one is a glass fiber optic delivery system. So that laser system, they have been produced by the glass fiber optic cable, and whereas the other carbon dioxide laser or your erbium laser, they are delivered through this hollow tube waveguide. Earlier it used to be delivered through the articulated arm. So this is a picture of an articulated arm, this is a hollow waveguide, and this is the fiber optic. The third one is a fiber optic glass cable. Now let's see how this laser works in periodontics. What I would like to add up here is that like it's that you cannot say laser is going to overcome the scalpel and अब scalpel use नहीं होगा ऐसा नहीं है. Every case has a different this thing कि कहीं में आपको laser use करने का benefit रहेगा, कहीं पे आपको scalpel use करने का benefit रहेगा. So it's, you cannot say that the laser is going to capture the market, and the conventional flap surgery or the conventional blade you won't be using. You will be using it, but as it is said, no, that one size doesn't fit all. So it's something like that. So let's see where you can use the lasers. Lasers can be used in periodiagnosis, in non-surgical periotherapy, as well as in the surgical periotherapy. For in the non-surgical periotherapy, the laser bacterial reduction, you can put the laser light inside the pocket and you can reduce the pocket depth. It can be used for calculus removal as well as for root conditioning. It can be used to treat the hypersensitivity and is also used in photodynamic therapy. So this is a slide showing how we use the laser for the laser bacterial reduction in the pocket, and this is the glass fiber optic cable. These are the settings, power settings, where the through which the light was delivered into the pocket and the pocket depth was reduced. This is the pre-op and the post-op picture. So lasers can be used in the surgical periotherapy also, in frenectomy, gingivectomy, gingivoplasty, operculectomy, vestibuloplasty, crown lengthening, gingival depigmentation. The advantage of using the lasers in the surgical therapy is that um, the field is going to be bloodless. It is going to be quicker with no time, and so this is a case of frenectomy, pre-op, post-op. This is a case where the laser were used for ankylosing, for tongue tie. It's just a 5-second work. And you can use these lasers in very apprehensive patients where really the pain is very apprehensive, or you really don't want the bleeding at that side, so you can use your lasers. And really, I love using the lasers in vestibuloplasty. This is my personal that in vestibuloplasty, a lot of bleeding is there. So, you can just save your time as well as patient's time by doing the vestibuloplasty with the lasers. This is the case where gingivectomy was done with lasers. Immediately, the patient gets the results. So, and without any blood. So, the patient is also happy, and so you are. Can be used for gummy smile. For deep pigmentation, the lasers can be used. There you need to use the diode lasers. Another case of depigmentation. That's another case. You have to use the light strokes, and yes, with lasers, the reoccurrence rate is really very low. The pigments reoccur at a very it may come after years altogether. So, and in some cases it doesn't reoccur also, but if it occurs in years. So these are the advantage of using the lasers in surgical perio. That is, reduces the bacteremia. That's a major advantage. It increase hemostasis and coagulation, minimal damage to the surrounding tissue, improved visibility, reduces the mechanical trauma to the patient. It causes the instant sterilization of the surgical site. It causes minimal postoperative pain and swelling, and that's the reason why it has a high patient acceptance. It's not only that lasers can be used in perio, it can be used in pedo, oral surgery, prosto, ortho, in you name this thing, the branch, and you can use the lasers. So lasers can be used in oral surgery. This is the example where we use the lasers. There was on the lateral side of the tongue, there was a lesion, and the ablative procedure was done with the diode laser, and postoperatively, that was the result. This is a case of leukoplakia. Immediately, that ablation procedure was done, and this was this was the result. Lasers can be used in orthodontics to assess the partially erupted teeth. And so in this case also we use the lasers. Immediately the patient got beautiful. This is although it's a 1 week post-operative picture. Labial frenal removal can be used immediately, and so yes, lasers can be used in endodontics. I'm just giving you a brief overlay of the lasers. The lasers can be used in perio as well as in other branches of the dentistry. So in endodontics, it can be used for cleaning and disinfecting the canal as well as in apical surgery. What you do, you measure the root length, and if let's suppose it's a 16 mm, root length is 16 mm, so you take your diode laser tip of 15 mm, 1 mm short of the tip, and you put it inside the canal, and then you fire the laser, and this causes the disinfect the canal. And you can use the erbium lasers also, or the diode laser, whichever. If you're using the erbium laser, it can be used for the equal length of that of the canal. But if you're using a diode laser, you have to be 1 mm short of the root canal. It can be used in pediatric dentistry for tongue tie. You know, in such patient, you will get a very high acceptance rate, because you know the pediatric patients, they are not very much compliant. So you can use the lasers in such cases. So it will be just a 5 or 10 second work, and the work will be done without any sutures. And really in putting the sutures in kids is really a difficult job, because I'm not a pediatric dentist, dentist, so I know it's really very difficult. Now this is a case where we did we removed the caries, and with the erbium laser. This is the case where phenectomy was done. Uh, Tongue tie, another case of tongue tie. Lasers can be used for bleaching purpose also, but you need to take care of that. You need to, cover the gum tissue, the gingival tissue, with the help of a gum guard, or you can use a rubber dam also. But that you need to be very careful while using the bleaching with the lasers. This is the pre-op, and immediately post-op. Here you don't get such a beautiful result immediately. You usually get it after a week. You get the beautiful result. You can use you can use lasers for such growth also. Okay, this a video. So otherwise, if you do it with the scalpel, there will be a lot of bleeding. With the lasers, it was just a minimal bleeding was there. So you can use the lasers not only for incisional purpose, for ablating purpose. You can use the lasers um, for treating nausea, for aphthous ulcer, herpes labialis, angular cheilitis, trigeminal neuralgia, and for TMJ disorders. Or you can use the lasers for even mucositis also. So it's not only for cutting purposes. You can use the laser. It can be used for pain management also, for healing purposes also. So in case if you have done your flap surgery, you can use the lasers for pain management after the procedure. And even for neuralgias, even for aphthous ulcer, or even for the TMJ disorders, you can use this laser. But the settings needs to be, you need to know the settings, and you need to use a low level laser therapy, because that's a total different science. And so you cannot use the ablation wala or incision wala laser handpiece for the pain management. It's a total different handpieces are there with a different power settings, so you need to learn those power settings. And these are the various articles. You can go back and see. This is we have a very famous periodontist is there, Dr. Sana. So we collaborated together, and we wrote, she contributed in my book about the lasers. So you can just go back and read this chapter, and very beautifully pre-op, post-op pics you will find there, and how to do the procedure. You can read about it in details. So for the lasers, I can only say that the more you use the lasers, the more uses you will find. And believe me, it has actually happened with me also. I just started using the lasers just for, um, basically, I actually started using the lasers for कि अभी bleeding ज़्यादा हो रही है, okay, this patient is not compliant, so I will use the laser in such cases, in those patients. But believe me, अभी मुझे ऐसा लगता है कि laser की बहुत सारे uses है. Even we have been trying to use the lasers for tinnitus patient also. For DMJ disorder, so definitely we have used, and we have got very beautiful results also. Even for post cancer patients, we have used the laser for healing purposes. So, but yeah, it has lot many uses, but we just need to use it. So coming up to the implant thing. Um, Before starting up the implant, I would say that it's not only that you have to, you just extract the tooth and put the implant. No, not at all. There's always a confusion, or rather, I should not say confusion. It's more of a big grade 3 mobile hai. Okay, extract the tooth and put the implant, because first of all, saving the tooth takes a lot of time, and um, and as well as for doctor's point of view, yeah, it gives a lot of money, but at the same time, it's something like, I would like to say that ऐसा नहीं है कि अगर मेरी फिंगर थोड़ी सी खराब हो गई है तो मैं उसको काट के और मैं दूसरे फिक्स कर दूं. Artificial is artificial, so you always need to save the natural structure of our bodies. So it's not that I've started placing implants, or I won't do justice to my branch. It's not only to do justice to the branch, it is about नेचुरल टूथ को हमेशा, या नेचुरल कोई भी स्ट्रक्चर को हमेशा कंजर्व करना चाहिए टू द लास्ट. And if it cannot be saved, then only extract and put the implant. That's a very simple and clear message I would like to give on this podium. So, well, you can place the implants in immediately. You can place it in a healed ridge. You can place it in a compromised state. But you need to know about the implant, because it is something like an artificial thing you're putting into the patient's body, so it will show its reaction. But at the same time, now the implants are made up of biocompatible materials, so it's not much of an issue. But in implant dentistry, it is said that it is 1 millimeter is equal to 1 kilometer. So it's something like आपको सारी measurements millimeters में है. So you need to be very precise in your working when it comes to implant dentistry. So you can, put the implants in the maxillary sinus also, but how you need to put it, that you need to know. So before placing the implants, in the in sinus, you need to do some preclinical exercises, and never hesitate to do any preclinical exercises. You know, you take a egg and you try to raise the membrane which is there. You make a round of that and put a circle inside the shell, and then you try to raise this membrane which is beneath the shell. And this is how you can practice preclinically the sinus augmentation procedure. Or you can use the models also. Nowadays the models are there. We used to take an egg, and then we used to raise the membrane without rupturing the egg yolk and the egg albumin. So this is how you go for the preclinical exercises before the sinus lift. So, if you are doing a sinus augmentation procedure, direct sinus augmentation procedure, you should know the anatomy well. You should know what is full thickness flap, how to raise a full thickness flap. अगर आप full thickness flap raise अच्छा से आपको आता है, आपको incisions पता है, वो आपको पेरियो से पता चलेंगे. It's so that's why I cannot say that leave perio and start working on implants. So it's the अगर आपको पेरियो अच्छे से आती है तभी आप बहुत प्यारी तरीके से full thickness flap raise करेंगे. Otherwise you will be raising a partial thickness and then the periosteum will be there over the bone and you won't be able to see the bare bone and you won't be able to place a beautiful implant. So you should know how to reflect how to give an incision, beautiful incision, and how to reflect a full thickness flap. Then you need to know about the anatomy, where you are going to make an enterostomy, whether it should be an oval enterostomy or whether it should be a rectangular one. That you need to be precise in your working, and it can be done only when you know the anatomy. Fine. And so these are the various way where you put two lateral windows. When the septa is there, then you have to you can make the two lateral windows, and then you have to very beautifully you need to raise the sinus membrane. I remember when I was writing a book, so uh, KK Gupta sir, I remember sir used to do a very beautiful sinus lift. So I requested sir, and sir contributed well in the chapter, and it's very beautiful pictures of his cases are there in the book, um, in the implant section. So in the dance implant section. He contributed very well, and you can just have a look. That was a very beautiful case of his, and he contributed well in the book. So yes, if the nerve is very near, inferior alveolar nerve is very near, and so there we can go for nerve lateralization. These are the slides showing the nerve lateralization. The nerve was very pretty close, so the enterostomy was done. This cortical plate was removed, and the nerve was, lateralization of the nerve was done, and the implant was placed, and then the nerve was put back onto the original position, and then the bone grafting and the membrane done. So if you have a very thin ridge, then we can go for ridge split. Just a very, if you have a very thin ridge like this, so we can, use a saw, and then we can split the ridge, expand it. We can place the implant. You have to graft that area and then, you know, suture back the flap. Or we can use, nowadays the denture burrs are there, we can expand the bone. But for expansion or for the ridge split, you need to have a cancellous bone there. So if you have only the cortical plates, and if you try to split the ridge, it's going to fracture up, that is for sure. So you have to at least have 1 to 2 millimeters of cancellous bone in between the two cortical plates. So I've just given you a brief outlay of the lasers and implants. We have our academy named as Zenith Academy. There train, we have the didactic lectures. We train the delegates and the participants with the lasers, with the implant. And it's not only that we have the lecture sessions, we do make them to do the preclinical exercises. And this is one of my favorite delegate, and now she is well in Dubai and she's doing well with the lasers. And this is our implant workshops. And it's not only that we make them to learn the preclinical exercises. We make them to do on the patients, but with guided mentorship. And we first make them to see the procedures, and then they do it themselves. These are again the preclinical exercises, and then they do on the patients. And these are our beautiful delegates. And it's a certificate course. We do conduct certificate courses and certificate workshops. And we celebrated our first anniversary um, in July. So if we train them well, so our patients are going to be well, and we will have such beautiful smile. And with this, I've just given you a brief outlay. Believe me, it's much more to learn about, because they were the two topics that need to be touched. So I just touched them a little bit, and this is how you can reach me, and you can enroll in any of our courses. And again, I would like to thank Dr. Saba. Seriously, very beautiful. Thank you for giving me this opportunity, and Dr. Shubham. Um, and Dr. Anmol, definitely the director of Cynodent, and Dr. Akshita, she's again a very dear to me, and KK sir is really very hardworking, and I really get inspired from him. So he's been like always motivating and very, you know. So thanks a lot, and that's all. And yes, pray with us that tomorrow India should win. So thank you.
Thank you so much, ma'am, for the informative session. As you beautifully and very simply explained all the things in the session. And I would also like to thank founder and CEO of Cynodent, Dr. Anmol Bagaria, ma'am, and co-director of our Cynodent, Dr. Ashish Chandra, sir, and my co-moderator, Dr. Shubham Bharti. Also, thanks to all the participants who joined us today. And I kindly request all the viewers to please like and subscribe our YouTube channel. Thank you so much, ma'am. Thank you once again.
Thank you.